In these times, science needs a bigger investment than any one university can maintain and keep going. So the Department of Science and Technology has invested in several research infrastructures to facilitate the development of science and the application of science in the country.
The country needs accurate, accessible and timely data to direct our decision-making around public health and development interventions. This is why SAPRIN was needed.
SAPRIN is the South African Population Research Infrastructure Network. This is an investment by the Department of Science and Technology in collaboration with the Medical Research Council to create what we call research infrastructures that enable high-quality science addressing the real issues occurring within the country.
This national research platform will be linked with universities, research councils, government departments, Statistics SA, as well as planning, monitoring and evaluation in the presidency.
SAPRIN is particularly focusing on humans and society to address issues that come out of our own unique history in the country. This requires strong science to understand how to intervene in a way that can improve situations for South Africans. We have 3 rural-based centres where the whole community is involved. It's about 250,000 people involved in the research program. So what SAPRIN will do first is to integrate and harmonize these research institutions and turn them into a national infrastructure.
At each of our 3 existing nodes, we have long-standing health and demographic surveillance systems. And HDSS follows people over time. SAPRIN field workers will contact households 3 times per year to verify whether all household members are still there, new members have joined, or if members have moved or died. At each of our existing nodes, we have dozens of different studies which are nested within this rich population infrastructure.
If we are able to link the information from the clinic and the household, you have this continuity where you can be able to monitor people at home and in the clinic. And for me, that's just brilliant.
So we are one of the few places in this world where we see patients in ART programs, but then we see them as household members, as fathers, as mothers, as children, in school, in employment, in their sexual relationships. So we have this power to see people across the health sector, but also in real life.
For years, I've been working on medical pluralism, and we have not been able to collect data longitudinally. But the robustness of the research environment there has allowed us to basically tap into cohort studies that have been completed to be able to do that sort of analysis.
We have employed some of the most cutting-edge quasi-experimental methods which allow us to see causality in real-life data. We have carried out research, I think, that has been quite influential politically, because we have robustly shown that multiple concurrent relationships where one person at essentially one time period has more than one partner is unlikely to be the single driver of the HIV epidemic.
The key thrust of our research here at the Institute is really understanding how genetic diversity in African populations actually contribute to states of health and disease. We're really trying to bring the partnerships together to have a platform that we can do research on for a very long time to come. So it's also about doing longitudinal research, about not seeing somebody just once. The genetics doesn't change, but what changes is the environment. And it's very often that combination between the environment and the genetics which can either make a situation better or worse. So with a study that we call AWIGEN, which is an Africa-WITS in-depth partnership, is actually engaged with 2 of the demographic health and surveillance centres, the one at Ashencourt but also the one at Dechale.
We are so privileged and proud to be part of the bigger project, and going to make a big impact in terms of the university as well. The building that SAPRIN is sponsoring at the university is going to enable us to engage more with the communities. The facility will provide a good training ground for the postgrad students, masters and doctoral students, which is going to give the university more leverage, in that field where we train more students. The impact down the line is on the people that we serve in this province.
Our main research has been on non-communicable diseases and their risk factors. We want to see how can we reduce these risk factors for non-communicable diseases in the community.
The project has really helped supporting all stakeholders that are involved in this project for collaboration and sharing of knowledge. That's why we're trying to reach out to the community to make them aware as part of health promotion, and then in the process try to make them see the importance of psychologists, traditional healers and medical doctors working together.
These long-term projects embedded in communities require dynamic, real and invested relationship with community leaders, community members and the SAPRIN leaders that are setting up and running this platform. So there's a big investment in people being part of the endeavour. It involves extremely ethical conduct, and community bodies help us review that and feed back to us about research being appropriate and understood and valued in communities.
So research, to me, it's very helpful. Problems that communities are having through research are addressed, and people are told how to go about doing away with this problem.
The beauty of SAPRIN is its ability to gain scale and context across multiple South African settings. Because of the legacy of inequality, exclusion, marginalization in South Africa, we have to bring the best science and the best scientists to where it's needed most. We feel that a SAPRIN, which creates a national platform, can indeed do just that. It can attract talented scientists across the disciplinary spectrum, and our task is to put them to work effectively, and in so doing, build both the scientific capability and, more importantly, contribute to national research and development that benefits all South Africans.